Good morning, friends. Welcome to our next learning session. In 1972, I joined the Wellington Hospital and I was posted in the Department of Medicine with the head of department. I was the senior resident, and this is the incidence when I was right in the casualty at about 7:30 p.m. A young boy about 18 years of age was brought in unconscious state. On interrogation, I was told that the boy, along with his another friend, had consumed some sort of medications in the area of Connaught Place. It was all sort of illegal activity and it was a medical legal case. I suspected and had been told that there are great chances that they had consumed opium. दोस्तों, इन दोनों लड़कों ने अफीम इस्तेमाल की थी जिसके लिए वो लड़का अनकॉन्शियस हो गया। उसकी दोनों आंखों की पुतलियां सिकुड़ गई थी, पिन पॉइंट पीपल्स हम उनको कहते हैं, पर उसको कोई बुखार नहीं था, ना ही कोई पैरालिसिस था। पेशेंट अनकॉन्शियस ज़रूर था लेकिन पैरालिसिस नहीं था। सो फ्रेंड्स, द पेशेंट वाज अनकॉन्शियस but he did not have paralysis, he did not have fever, his pupils were pinpoint. This shows us that it is not the bleeding inside the brain. We medically know in pontine bleeding, and that is bleeding inside the part of brain which is called brainstem. It can lead to paralysis of the body, pinpoint pupils, and pyrexia, that is a fever, but none of these were present. So I immediately started DNS, 5% DNS intravenous infusion at a rapid rate of about 2 to 3 ml per minute to expedite the excretion of the drug. I started also oxygen to maintain the respiration and started the gastric lavage to remove the contents from the stomach. But though it was a teamwork, but with our best efforts, we could not save the boy. But within 1 hour, the other boy was also brought. He was semi-conscious and he also did not have paralysis or fever and pupils are pinpoint. Therefore, we adopted the same conservative treatment and we were able to save the boy. दोस्तों, थोड़ी देर में ही दूसरा लड़का आ गया, उसकी भी वही हालत थी, लेकिन हमने उसको सेम ट्रीटमेंट दिया और वो लड़का बच गया। अब इससे पहले कि मैं दूसरे केसेस के बारे में बात करूं, मैं आप लोगों को कुछ दिखाना चाहता हूं। Now see, friends, here, what do you see in the diagram? Now I make it very close to your screen so that you can understand what is this. Now look here, what I have marked is this is a gastric lavage tube. It is gastric lavage tube, and what do you see here? This is a funnel which is attached with the tube itself. See, this funnel is a part of this tube, and this tube is called the gastric tube. You see, this is our gastric tube, and then it goes, after taking a turn here, mandible at this place. This is the broken part. This goes here. This is the tip of the needle. This is the tip of the tube. See, this tube, if you trace it like this here, if you trace it here like this, it goes round here, and then it goes here, and this is the tip of the tube. So this tip is used to pass this tube through the mouth. How do we open the mouth? This is the what is called mouth gag. This is the mouth gag. You see, this is put in the mouth between the teeth so that patient cannot close the mouth, and through this hole in this mouth gag we insert this tip of this tube through this, and pass it in the esophagus, going right along the wall of the throat. दोस्तों इसको पास करने का तरीका ये है कि इसको मुंह में ये माउथ गैग लगाया जाता है जिसके बीच में एक होल होता है। ये माउथ गैग ये हेल्प करता है कि पेशेंट अपने दांत मुंह बंद ना कर सके ताकि प्रोसीजर करने में आसानी हो। जब हम इसमें से ट्यूब को डालते हैं तो ट्यूब गले के पिछले हिस्से में चली जाती है और पिछले हिस्से की तरफ बड़ी इंपॉर्टेंट चीज़ होती है, हमें उसकी तरफ जाना है क्योंकि हमारा फूड पाइप जो होता है वो पिछली तरफ होता है, आगे की तरफ हमारा विंड पाइप होता है। अगर ये गलती से आगे की तरफ जाएगा तो वो हम विंड पाइप में चले जाएंगे तो उससे पेशेंट मर भी सकता है। हम क्या करते हैं, हम इस ट्यूब को पीछे गले के पीछे ले जाते हैं और पेशेंट कई बार वॉमिटिंग का फीलिंग भी पेशेंट को होता है। इस समय हमारे लिए वो इम्पॉर्टेंट नहीं है, हम उसके साथ इसको पुश करते जाते हैं डाउन इनटू द फूड पाइप एंड देन वी रीच द स्टमक। उसके बाद हम क्या करते हैं, हम इस फनल में सॉल्यूशन डालते हैं जो इस ट्यूब से होता हुआ स्टमक में जाता है और फिर इसी ट्यूब से जब हम पेशेंट को टिल्ट करते हैं तो वो सॉल्यूशन बॉडी के बाहर आ जाता है। 3-4 बार ये प्रोसीजर करने के बाद पेशेंट की ट्यूब निकाल ली जाती है और हम वैसा विश्वास करते हैं कि पेशेंट अब जो है पेशेंट का स्टमक जो है साफ हो गया। सो फ्रेंड्स, I will explain in English also that this is the funnel attached to the tube. This is the tube. It is a rubber tube. It is a wide mouthed tube. Its lumen is not narrow like rice tube. Rice tube has a narrow lumen, but this has got a broad lumen. This goes like this. This goes like this, like this, like this, and then this is the tip of the tube. Now this is the mouth gag. This we keep between the teeth and we enter the tube or pass the tube through this hole, going right to the back of the pharynx or throat, and then push it down into the food pipe and reach right into the stomach. We can inject a little air into this funnel and auscultate on the epigastrium, and we can feel a gush of air going into the stomach. That tells us that our tube is in the stomach. Then we add the irrigating solution into this funnel, which passes through this tube into the stomach, and then we remove it from the same tube by tilting the patient to the other side. When we do 3-4 times this procedure, the stomach skull is thoroughly washed and our procedure is complete. Friends, what solution we use for irrigating the stomach or washing the stomach? Commonly used solutions are, now I bring it close to you, is plain water. That is very commonly used, or it can be normal saline or activated charcoal. Even sometimes activated charcoal is also used in certain poisoning. It varies, but in our case it was not a problem. What is important to understand is there is some solution which we pass. Commonly it is normal saline or plain water or sometimes charcoal water, or we can use any such solutions but not any caustic solution. There are some other solutions which can be used. I keep it here for your later reference. You can make notes of these fluids. For example, it can be sodium bicarbonate, tannic acid, sodium thiosulfate, and calcium gluconate. These can be the various solutions which can be used. Now friends, what happened then? In another case, I am going to tell you, a young female doctor who was a homeopath, her husband was also a homeopath, and she had some fight in the family, in-laws family, and took about 10 tablets of compose. Compose is the diazepam. 5 mg tablets were available, and she consumed 10 tablets that making it 50 milligram. I was consulted immediately, and I took the patient. I did the gastric lavage bypassing the gastric tube, as I told you the procedure. I used the normal saline for washing the stomach, and within half an hour we brought the patient home, giving her the coffee as a stimulant. I here why I did not have to make too much of effort was because it was immediately. She took the tablets and immediately I was contacted, and within half an hour we had finished the procedure. In another case, an anesthetist वो डॉक्टर होता है जो पेशेंट्स को बेहोश करने के लिए दवाइयाँ इंजेक्ट करता है या गैस उसको गैस से बेहोश करता है. ये एक स्पेशलाइज्ड फील्ड होता है, पर वो एक क्वालिफाइड डॉक्टर होता है. इस डॉक्टर की वाइफ भी डॉक्टर थी, सो इन्होंने मुझे रिक्वेस्ट की उसको अटेंड करने के लिए. व्हाट हैड हैपेंड, द डॉक्टर वाज यूज्ड टू टेकिंग बीटल लीव्स, and of course he was very much fond of taking alcohol, and he will not take just one pack. He will pick up in any function 3 glasses, 3 packs, and gulp them down. That was his addiction for the alcohol also. Somehow he had taken some sort of thing along with betel leaves and became unconscious. I again took him to the hospital and passed the rice to myself and used 3 bottles of dextrose DNS to wash his stomach, and as I finished the washing of stomach, he became conscious. So we brought him home. Still, in another case, an elderly Sardarji had consumed some tablets in a fit of anger, and I was called to attend on him. It was the area of Jorbagh of Delhi, and in the history they told me that he consumed about 30 to 40 tablets of Valium. When I checked the bottle, it was Valium 2 milligram. 40 tablets meant he had taken about 8 milligram of Valium, which was by no means a dangerous dose. Now, I advise them to continue with the treatment at home and give him stimulants like coffee, and he made complete recovery. Some 45 years back, another case came to me. A friend of mine who was well placed, and he brought his secretary that she has consumed some tablets. This was just question of 5 or 6 diazepam tablets she has consumed because she was having an affair with my friend, and when her parents decided to get her married, she felt disappointed, and in a fit of disappointment she took this step. When he brought to me, I calculated the amount. I said nothing need to be done. There is no need of giving a stomach wash. Just wait and watch, and she will recover of its own. And she did recover. A young boy who was about 26 years of age again took 4 to 8 tablets of diazepam with the aim of coercing his family for some purpose. He was brought to me in Wellington Hospital. I did the stomach wash, and the boy was fully conscious. Therefore, there was no problem. I did not admit the patient. I sent him home. In a case of 73 years old female, again there was some family problem, and she took some tablets of alprazolam. Now it is also a tranquilizer. When I checked, it was 0.25 milligram tablets, and even 20 tablets would not make much difference. So, but she had stopped taking fluids as well as stopped eating. The result was that she developed dehydration. So she was taken to the hospital. The doctors was hesitant in starting the fluids because the electrolytes results were not available immediately, and they said that can create a problem. I think this was all useless argument. The patient should have been started fluids immediately. Anyhow, fluids were started at my persuasion, and the patient started improving, though hospital made their point by keeping the patient for 5 days and without any significant investigation. If the patient was unconscious, or you were suspecting some poisoning or some cerebrovascular accident, you should have done CT scan right in the beginning. They didn't do it, but when I insisted on her discharge, they said that wait for 1 or 2 days more, we will do the CT scan. I said there is no need of CT scan. You see, this is how the people befool the public at all. The doctors befool, some of the doctors, I don't say all doctors are not like, but some of the doctors do befool the public like this, that we will do CT scan and this is not required. And in this case, I knew the history personally, and I knew that there is nothing wrong with the patient. Only thing is that it was a fit of anger that she took this tablet. She did not eat deliberately. It means she was deficient in fluids. She had to be given fluids. We gave it, and she became perfectly all right. And it is the now almost 10 years to this incident, and there is no problem after that. So friends, we will continue with next time with some other interesting cases. I will make the same request which I do each time, but please do bear in mind that your comments, your efforts on Messenger doesn't bear any fruit. You please do this on the video itself. There is if you open the video, there is a thumbs up sign also. If you want to give thumbs up sign, there you give your press this thumbs up sign, and below my name there is a column of comments, and as you click content, the space is created against your name. You can write there whatever you feel like, good, nice, or bad, or any improvement, or you want some other thing, some other topic to be discussed, you can write there. But I request all of you to give all these things on the video. Don't be in a hurry that I send you the message that you immediately give a thumbs up sign. That has no significance at all, and that doesn't make me also happy in any way. After all, you are all my friends, and we look into the interest of each other. Thank you. So friends, I once again thank you all for your patience listening and doing the needful.